Hi, this is Dr. Terrence McCadden at West County Plastic Surgeons of Washington University in St. Louis, Missouri. And here I'd like to discuss when one would consider doing a tummy tuck versus doing a lower body lift. So essentially, these are all different flavors of skin reduction around the trunk, potentially muscle tightening and fat removal. There's different flavors of these. So essentially, we start with the mini tummy tuck, and this is just a short incision over the pubic area typically. These are actually relatively uncommon procedures because essentially what we're doing in these procedures is predominantly tightening the six-pack muscles, bringing them back together and removing just a small amount of skin. And it's just a select few patients we find that typically would qualify for that type of operation. The second iteration, the next step up, is a standard tummy tuck, and that's a very common operation. Essentially, in a standard tummy tuck, the incisions are made sort of from hip to hip along the lower part of the abdomen. We try to make it such that it's well hidden, typically underneath most types of swimsuits as well as underwear. There's also with this typically a scar, or very often a scar around the belly button as well. And this is going to be for people who have typically following pregnancy, for example, they've developed some loose skin, but that loose skin is typically confined to the front of the abdomen and sort of between the two hip pointers, or in plastic surgery, we refer to these little protuberances as the anterior superior iliac spine. It's just these little pointy aspects of the pelvic bone. So if the skin excess is between those areas, that typically translates into getting a standard tummy tuck. Now, that excess skin, particularly if you've had more weight loss, can start to extend further back. So if it's a few inches past those little protuberances or the anterior superior iliac spine, then that means that we're looking at potentially doing what's called an extended abdominoplasty or an extended tummy tuck. This means that that incision isn't just from sort of hip pointer to hip pointer, it continues on usually for several inches on either side of that. And we would do that because the excess skin, or what we often refer to as the apron, is that sort of a crease that develops is extending well past just the front of the pelvic area. And so we need to remove that skin, that incision gets longer. Now, as we start to see patients who've lost tremendous amounts of weight, either through diet and exercise, weight loss surgery, patients who've lost 80 pounds, 120 pounds, 200 pounds, essentially they have a lot of redundant skin relative to the size of their frame. And that excess skin extends not just in the front, but that can extend into the flanks on the side and all the way into the back above the buttock area. And creases can also develop in the bra roll area and below. So in those cases, we can't just do a tummy tuck and liposuction in the back, because if we, in somebody, for example, after pregnancy, we will just do a tummy tuck and liposuction in the back. But for folks who have lost a lot of weight, there's a lot of extra skin. And doing just liposuction in that back area there is going to lead to potentially even more loose skin and won't really address the main issue, which is all of this skin excess. So in order to address that, we need to be removing more skin. And thus, we do different forms of body lifts. And what that translates to is that that scar that started in the front with the tummy tuck extends back through the flanks and then extends back into the back of the flank, into the lower back. And there's different flavors of those. Those can kind of come sort of just above the buttock area, but they can also come up and up onto the flanks. And then our decisions in terms of the heights of those scars go into things like not wanting to flatten the buttocks too much, trying to conceal a scar versus trying to narrow the waist. And different incision locations do a better or worse job of addressing some of those nuances. And so, of course, at that point, every patient's a little different, and that's a conversation that you'd want to have with your plastic surgeon to see what the best way would be of addressing that excess skin. So at the end of the day, lower body lifts are generally reserved for folks who've lost substantial amounts of weight. Tummy tucks generally are performed on people who have either had children, have been pregnant, lost the weight, have loss of loose skin, but then also people who've also undergone weight loss, but perhaps not as much weight loss as some other folks that may be better off having a body lift. So hopefully that is useful information for you. And if you're considering any of these types of procedures, please consider us here at West County Plastic Surgeons of Washington University in St. Louis. Thanks very much.